talk about some other important issues for you at the federal level. How about health care? Anybody think the health care issue is important? Yeah, me too. I'll tell you a little bit about me. It's a good segue for that. As you know, I'm a medical doctor. I grew up in the Northwest. I got my undergraduate degree at the University of Washington. My degree was in cellular and molecular biology. I graduated magna cum laude with college honors from UW. And I attended Harvard Medical School. Graduated from medical school in 1993. Did residency training at the Johns Hopkins Hospital in Baltimore. And now I'm in primary care practice. I'm a solo practitioner. I do home visits. I don't even have an office now. I do home visits for mainly Medicare and Medicaid patients and uninsured patients. And of course, Medicare is for our seniors, the permanently disabled and those on kidney dialysis. And Medicaid is for the very poor in our country. And some of my patients have both Medicare and Medicaid, because you can be a senior and you can be very poor and you can have both Medicare and Medicaid. Those programs are in trouble, I can tell you firsthand, because I'm one of the few private doctors in the area that will see mainly Medicare, Medicaid, and uninsured patients. In fact, it's gotten so bad that many times when I try and refer my patients for specialty care, I have a really hard time finding specialists who will see them, because nobody wants to see a Medicare or a Medicaid patient, it seems like. And this is a growing problem, folks. It's not getting better, it's getting worse. Why is it getting worse? Because the number of people with Medicare and Medicaid keeps growing, but the resources for Medicare and Medicaid are in trouble. So it's a bad combination. So let's talk about what we need to do. First, we need to repeal the Patient Protection and Affordable Care Act, because what it has done to Medicare and Medicaid is cut $500 billion, actually a little more than that, out of the budget over a 10-year period. That's about 10% of the Medicare budget, for reference. Wow, we're cutting 10% of the budget when the enrollment is growing? Ooh, sounds like a problem to me. Yeah, it's a big problem. And so we've got to deal with that. This was a hit-and-run job. That act cut the money, had no reasonable way to rebuild the program so it can survive and be there for our seniors. Okay, we've got to address that. Number two, Medicaid for the poor. Same phenomenon. The enrollment is growing partly because the Act raises the income level that allows you to qualify. So Medicaid is for poor people with low incomes. You raise the income level that they qualify at, more people become eligible. In fact, to give you a perspective, we're expecting 400,000 new participants in the Medicaid program in the coming years, right here in Washington State alone. 300,000 to 400,000 because of this new policy. And I told you, I'm one of the few private physicians who sees mainly Medicare and Medicaid patients. And so many of my patients will call me up and say, Dr. Coday, I've been calling through the phone book, dozens of doctors' offices, and you're the first doctor that will see a new Medicaid patient. Now, I'm not seeing new ones right now because I'm campaigning, but historically in the practice, that was the case. That's the kind of crisis we have. We don't have enough doctors enrolled in the Medicaid program to absorb all of these new patients, folks. It is not going to work. Well, what can we do? Well, here's some things we can do. First, let's refocus the program on the very poor, not use it as a dumping ground for anybody who lacks insurance, which is what the Obama administration tried to do and is trying to do. Let's reserve it for the poorest of poor, but let's make sure that it's a well-run and properly funded program, limited in scope, but it actually does a good job for the people on it, so that we take care of all of their problems, like their substance abuse, for example, or their mental illness. And by the way, those two conditions, in my experience in the Medicaid program, are very prevalent in the Medicaid population, because think about it, these are two factors that cause people to become poor and stay poor. If you have a crystal meth or a cocaine habit or heroin habit, you can't keep a job. You can't run a business. You're spending every dollar that you acquire paying for your habit. That's just the way it works. And your life falls apart, and your family falls apart. Your kids go on welfare because you can't support them anymore. It's a disaster all the way around. But did you know that when I try and get help for my patients who have substance abuse problems from the Medicaid program, it's very difficult because Medicaid has great limitations on what it will cover. And so many of the doctors involved, like the pain treatment specialists who deal with substance abuse issues, the psychiatrists that are involved in this, the inpatient detox facilities, many of them don't take Medicaid. for the psychiatric problems. So we've got these patients that are poor because of these problems, and we're not even treating them. We're letting them go on in their untreated condition. They stay poor, they stay on Medicaid, and they not only stay in the program, but they don't take good care of themselves in many cases, because when you're using drugs or when you're mentally ill, your ability to care for yourself physically goes way down. You have more accidents, and you don't take good care of your diabetes if you have diabetes, and a whole host of problems that create other medical bills and problems. So we need physician leadership in the Senate that says, I understand this. And I'm going to reach out to Democrats over here who want to care for the poor. And I'm going to reach out to Republicans over here who want to cut costs. And we're going to have a win-win solution that gives better care to people and saves costs. Yes, it can really be done, but no, it will not be done with the current leadership. We need new leadership that really understands it. That's one of the reasons I'm running. Let's talk about healthcare in the private sector. Ever since that act passed, prices for insurance premiums have just gone through the roof. I mean, through the roof. And they call it the Patient Protection and Affordable Care Act. I'm not sure who it's affordable for, but not you and me. Well, if we want to make private insurance more affordable, let's do a few important, simple things that don't need bigger government, don't need 16,000 new IRS agents, don't need more tax money. Let's do the following. Let's require that insurance companies play on equal footing with consumers and businesses and providers, because right now they don't. They are immune from the Sherman antitrust laws, did you know that? Which allow them to practice very anti-competitive behavior. They collude with each other. They'll never tell you they do, but I can tell you effectively they do. Effectively they fix prices. Effectively they blacklist certain types of patients. You know what I mean? And if we made them play by the same rules that all other businesses play by, I think a lot of that would go away. There would be greater transparency and price reductions and more competitiveness that goes with it. Let's allow you, the consumer, to purchase insurance across state lines so that there will be more competition and more choice. That will be better products at lower prices. And finally, let's have some tort reform. Dr. Roger Stark, who is a retired heart surgeon from the Northwest area, he is a policy analyst with the Washington Policy Institute, tells me that he estimates that healthcare costs are inflated by between 20 and 30% in America because of an out-of-control tort system or lawsuit system. So I believe that under the Constitution, the Congress does have the authority to regulate interstate commerce, and I do believe medical malpractice is effectively an interstate issue because you're dealing with interstate health plans like Medicare and Medicaid, and like all of the private plans should be if we allow it to be purchased across state lines. And people move from state to state. And some of the big healthcare providers, like Healthcare Corporation of America, are interstate in nature. So effectively, this is an interstate commerce issue, which I believe constitutionally means it comes under the purview of the Congress to regulate it. So why doesn't the Congress step up and do that? So those are a few thoughts on healthcare. I could go on for hours about healthcare. I want to summarize that by saying I believe I'm uniquely qualified to provide leadership on that issue. We only have 3 senators that are physicians in America, and yet we're spending well over 25% of federal dollars on healthcare. The Centers for Medicare and Medicaid alone consume about 25% of federal spending, but the federal government pays even more than that for healthcare through other healthcare programs like the VA system and like the healthcare plans, private plans for all of the government employees. It's probably paid close to 50 cents on the dollars around the estimate on healthcare one way or another. But we only have 2 senators that are physicians. Well, 3. One might not run again, but we only have 3 right now. I think 4 would help a little bit. I think the healthcare issue will be a winning issue in blue Washington State, even Puget Sound. I'll give you an example of why I believe that. Last month, I was invited to be the keynote speaker in Coeur d'Alene, Idaho, for the annual meeting of the Washington State Neurosurgeons Group. They have their professional organization, and they meet annually. And I was so thrilled that as a general practitioner, the neurosurgeons invited me to speak to them. I thought, wow, that's really cool. And they wanted me to speak on why I'm running for the Senate as a doctor, number 1, and number 2, healthcare policy. And so I did. I gave a keynote address Friday night at their dinner. And I'm so pleased to tell you that a whole bunch of them have endorsed me and made big donations to my campaign. And one of them said to me, he said, and his name is Richard Ellenbogen. He's the chief of neurosurgery at the University of Washington. Dr. Ellenbogen publicly, in front of his peers, endorsed me, gave me a $500 donation. That's all public record, so I'm not spilling beans. If we report it, it's all public. And he said, Art, I'm endorsing you and supporting you. But I want you to know something. I am a lifelong Democrat. But I'm going to support you because it's time to support the best candidate.
Wow.
That's how we're going to win at Blue Washington and Blue Puget Sound. A, by sticking to our principles as Republicans like Reagan did, and he got 59% of the popular vote in Washington State for a second term in 1984. And B, winning on the health care issue. Because even Democrats are looking for real leadership on the health care issue. As you know, the U.S. Supreme Court has heard the case on the health care mandate challenge, the mandate that requires us to buy insurance or face tax penalties, businesses and individuals alike. They're expected to rule this month. It could be any day now. I think they're going to strike the mandate down. If they don't sever it from the rest of the bill, they're going to effectively strike the whole act down. It's going to be like a nuclear detonation at ground zero. If you thought you heard a lot of row over health care prior to the passage of the Patient Protection and Affordable Care Act, wait till it goes down. And if any part of this left standing, I'm committed to appealing it. It's going to reopen the discussion. People are going to look at Senator Cantwell and say, you know, you had the Senate, you had the White House, you had the U.S. House, and all you could do is pass a bill that gutted Medicare and Medicaid, raised prices in the private market, and even though people told you it was unconstitutional to have a mandate, and you promised President Obama you wouldn't, you did it anyway, and the court stepped in and did the right thing and knocked it down. You've had your turn, Senator Cantwell. Let's get some real leadership in the Senate. That's why people like Dr. Ellenbogen are supporting me. That's how we're going to win in this blue state, believe it or not. I'm your man. There is nobody in this race who can come close. I'll be your guy. We will win on this issue. And the best part is, we will get meaningful health care reform, I believe, because I think at this point, people will be ready to have the serious discussion about health care reform, and it will be bipartisan. I will work with Democrats and Republicans and independents, as few as they are in the Senate, to get meaningful health care reform, which we all need, and it's a winning issue for us.